Elbasvir-Grazoprevir tablet is used to treat chronic hepatitis C, a viral infection of the liver. It helps reduce the amount of hepatitis C virus in your body, which in turn helps your immune system fight the infection and may help your liver recover. This medication may also be used with certain other medications, such as ribavirin. Chronic hepatitis C infection can cause serious liver problems such as scarring, cirrhosis, or liver cancer. It is important to note that it is not known if this treatment can prevent you from passing the virus to others. Be sure to not share needles and practice safer sex to lower the risk of passing the virus to others. As for the dosage, it is best to take this medication as directed by your doctor. And remember to take it at the same time each day to help you remember. Before you take Elbasvir-Grazoprevir tablet, make sure to read the patient information leaflet from your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once a day. It's best to take it at the same time each day to keep the amount of the drug in your body at a constant level. Remember to continue taking this medication for the full length of time prescribed, even if your symptoms disappear. Stopping the medication too early may result in a return of the infection. Some common side effects of Elbasvir-Grazoprevir tablet include tiredness, headache, or nausea. If these effects persist or worsen, it's important to let your doctor or pharmacist know. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks. Most people using this medication do not experience serious side effects. While rare, a serious allergic reaction to this medication can occur. Seek immediate medical help if you experience symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. As for the optimal timing and dosage, it's best to follow your doctor's instructions. Typically, Elbasvir-Grazoprevir tablet is taken once daily. If you have any concerns or questions about the medication, don't hesitate to reach out to your healthcare provider. This tablet, Elbasvir-Grazoprevir, is used to treat hepatitis C. However, it's important to note that it may rarely cause serious liver problems and can make other liver problems, such as hepatitis B, worse. If you have a history of hepatitis B or any other liver problems, it's crucial to inform your doctor before starting this medication. Be sure to tell your doctor immediately if you experience new or worsening symptoms of liver disease, such as persistent nausea and vomiting, loss of appetite, stomach/abdominal pain, dark urine, or yellowing of the eyes or skin. It's important to follow your doctor's instructions and take this medication as prescribed for the best results. Before taking Elbasvir-Grazoprevir tablet, make sure to inform your doctor or pharmacist if you are allergic to Elbasvir or Grazoprevir, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have other liver problems, overuse of alcohol, HIV infection, or diabetes. If you have diabetes, your blood sugar may be lower with hepatitis C treatment, which can increase your risk of low blood sugar. Your doctor may need to adjust your diabetes treatment plan, so be sure to tell your doctor right away if you experience symptoms of low blood sugar. If you are planning to have surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, Elbasvir-Grazoprevir tablet should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. If this medication is used in combination with ribavirin, it must not be used during pregnancy by either the pregnant woman or her male partner, as ribavirin may harm an unborn baby. Reliable forms of birth control must be used whenever at least one sexual partner is using these medicines together. It is unknown if the medications in this product pass into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Elbasvir-Grazoprevir tablet, as they can affect how the medication works and may increase the risk of serious side effects. Make sure to keep a list of all the medications and herbal products you are using and share it with your doctor and pharmacist. Do not change the dosage or stop any medication without consulting your doctor. Some medications can impact the removal of Elbasvir-Grazoprevir tablet from your body, which can affect its effectiveness. These include azole antifungals, bosentan, cyclosporin, efavirenz, etravirine, modafinil, nafcillin, HIV protease inhibitors, rifamycins, drugs used to treat seizures, and St. John's wort, among others. It's important to discuss any concerns or questions about potential drug interactions with your healthcare provider. They can provide guidance on the best time to take Elbasvir-Grazoprevir tablet and the appropriate dosage for your specific needs. If someone has taken too much Elbasvir-Grazoprevir and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, you can reach out to a provincial poison control center. It's important not to share this medication with others. Before starting this medication, during use, and after completing treatment, it's essential to have lab tests to check your liver function, and for hepatitis B and C, make sure to keep all your medical and lab appointments. If you are taking this medication with ribavirin, it's recommended that female patients or female partners of male patients take a pregnancy test before starting treatment. Pregnancy tests should continue to be done while using this medication and for some time after stopping to ensure no pregnancy occurs, for 9 months for female patients and for 6 months for female partners of male patients. If you forget to take a dose, take it as soon as you remember. But if it's nearly time for your next dose, then just skip the missed one and take the next dose at the usual time. Don't take 2 doses at once to make up for the missed one. It is important to store Elbasvir-Grazoprevir tablets in the original package at room temperature, away from light and moisture. Moisture can affect the medication, so avoid taking the tablets out of the original package to store in another container, like a pill box. It's also not recommended to store it in the bathroom. Keep all medications away from children and pets. When it comes to disposal, do not flush the medication down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.